Welcome to today's Explainer. We are diving straight into one of the most urgent yet wildly underdiscussed crises of our time, the post-antibiotic era. For decades, right, we've been completely conditioned to believe that modern medicine has all the answers. You get sick, you go to the doctor, you get a pill, and you're cured. It's the traditional path laid down by John D Rockefeller's allopathic model. But what happens when those miracle drugs just stop working? Today, we're unpacking a massive paradigm shift. From the source material, we're looking at a proposed solution from a whistleblower who says it's time to disrupt that old model and offers a true beacon of hope through decentralized AI-powered healthcare. Okay, we have to start with this absolutely terrifying projection, 60%. The sources project that by the year 2028, antimicrobial resistance, or AMR, is going to hit 60%. This isn't just some minor speed bump, guys. This literally means that in just a few short years, the bugs, bacteria, viruses, fungi will be so resistant to our current treatments that almost every modern advance in health could just abruptly halt. Think about it. Routine surgeries, cancer treatments, even a scraped knee could become a fatal risk, all because the very foundation of our medical security is crumbling right under our feet. The warning here is stark. If we don't wake up to this now, it's going to result in totally needless deaths. Now, I want you to really absorb this quote from the sources. They're dying because the closet of antibiotics is empty. It hits hard, doesn't it? It perfectly captures this silent pandemic that's happening right now. The argument here is that the healthcare model we've built over the last century, which is heavily focused on chemical cures, has a massive, glaring flaw. Those chemicals have an expiration date. The microbes have evolved, they're outsmarting our drugs, and our centralized healthcare systems are getting totally overwhelmed because they're digging into a toolkit that's basically empty. To give you a real sense of how bad this already is, let's look at the prevalence of multi-drug resistant organisms across the globe. In the Netherlands, it's sitting at 10.8%. Jump over to Italy, and it spikes to 31.5%. But then look at India, a staggering 83%. I mean, wow. These numbers are a massive red flag, showing how deeply vulnerable our global health ecosystem is today. When we abuse antibiotics, like taking them for a viral infection where they literally do nothing, we're basically giving bacteria a masterclass on how to survive. We're breeding superbugs. And this data proves the tipping point isn't off in the distant future. It is here, right now. So how exactly did we end up in this mess? Well, the source material points the finger at something called cookbook medicine. As healthcare became more digitized and hyper-focused on financial efficiency, true clinical wisdom was kind of pushed aside. It got replaced by these rigid, fill-in-the-blank flowcharts. Doctors and nurses are now forced into what the text calls a sterile gaze. Basically, they're staring at a screen instead of really looking at the patient. This one-size-fits-all model creates massive blind spots and pushes practitioners to overprescribe antibiotics just to avoid lawsuits. And ironically, this turns our hospitals into the exact amplification zones for the superbugs we're trying to destroy. But someone actually saw this coming. Enter Dr. Kadiyali Srivatsa, an incredibly experienced critical care doctor. Check out this timeline. Way back in 1989, he was already ringing the alarm bell about antibiotic-resistant bacteria. In the 90s, he connected the rapid spread of MRSA right back to hospital IV procedures. And then, in 2006, he officially blew the whistle on these dangerous cookbook medicine practices in the UK's National Health Service. He saw the systemic errors causing harm. But as often happens with whistleblowers, instead of being hailed a hero, the institution pushed back. The text notes he was professionally isolated and ousted, simply for trying to protect the public. You know, Dr. Srivatsa didn't just give up. He took decades of clinical wisdom and channeled it into a totally new paradigm. We're talking a complete 180 here. On one side, you've got the old way, cookbook medicine. It's centralized, reactive, and builds this huge dependency on doctors and chemical cures. But on the flip side is his vision, cognitive public health. This is about decentralization. It emphasizes actual prevention, protection, and true healing. He makes a really fascinating point here, that drugs seldom actually cure. Instead, they often disrupt our body's natural ecosystem, which can lead to autoimmune issues and just keep you dependent on the medical system forever. Cognitive public health is designed to break that vicious cycle. And that brings us to the technological heart of his proposed solution, Dr. Maya AI. This system was built entirely outside those traditional, rigid institutions. The whole goal? To help humanity conquer the fear of illness. Because let's face it, when we feel sick, we usually panic, run to the clinic, and demand a quick fix. Dr. Maya steps in to empower you to self-diagnose. It gives you the actual knowledge to tell the difference between a genuinely serious infection and just a minor bug, which is absolutely crucial if we're going to reduce our reliance on hospitals that are already buckling under the weight of superbugs. The genius of the Dr. Maya system really lies in this brilliant four-color spectrum. It takes all that incredibly dense medical data and translates it into a universal language that literally anyone can grasp. Red, that's an emergency. Get help now. Blue, suspected infection, so you need to isolate immediately. Yellow is moderate, maybe check in with a chemist or doctor. And green just means it's minor, so get some rest at home. By making symptoms this clear, Dr. Maya acts like a digital guardrail. It's what they call cognitive offloading. So when you're panicked, you know exactly what to do without rushing to a hospital and exposing yourself to resistant bugs. Now, the way this works leads to what Dr. Srivatsa calls the art of self-diagnosis. Unlike that rigid one-symptom flowchart we talked about earlier, Dr. Maya actually requires you to look for a real pattern. You input at least 3 symptoms. Then, the AI analyzes how they combine, basically mimicking the deep clinical reasoning a seasoned doctor uses when taking a patient's history. It connects the dots to help you see, for example, if you're dealing with a basic viral fever or a localized bacterial infection. It's totally empowering because you finally understand why your body is reacting the way it is. I want to pause and zoom in on the blue code for a second, because the sources frame this as our ultimate pandemic defense mechanism. If the AI spots a cluster of symptoms that points to a contagious bug, you get a blue code. It's effectively telling you, hey, you are a vector right now. Do not hop in a taxi. Do not go sit in a crowded doctor's waiting room. Isolate immediately. That one seemingly small choice to just stay home, that is exactly how we stop infected folks from spreading these highly resistant pathogens and turning a local outbreak into a global nightmare. Ultimately, Dr. Maya represents this profound philosophical pivot, beautifully summed up by the quote, "Knowledge of health is knowledge of life." The sources detail how Dr. Srivatsa's mission is to pull us away from this constant state of fear and medical dependency and move us back toward a symbiotic relationship with our own bodies. For so long, this strategy has been like a war, just nuke the bacteria with chemicals. His approach is more live and let live. We identify and prevent the bad bacteria from taking over, but we preserve the body's natural ecosystem. It completely disrupts this modern myth that we constantly need medical intervention just to be healthy. And to make this a reality in our neighborhoods, Dr. Srivatsa developed the Prima Kiosk. Think of it as the physical bridge for all this AI tech into the real world. It's an actual kiosk equipped with medical-grade sensors and powered by Dr. Maya, designed to be placed right in local communities. It acts as a frontline defense fortification. By offering early decentralized triage right where people live, the Prima Kiosk can spot those ground zero cases of resistant infections before they spiral out of control, keeping those patients out of centralized hospitals where cross-infections spread like wildfire. So, let's tie this all together. What we're looking at is a comprehensive post-antibiotic defensive strategy. The goal is to completely flip the script, moving from a fragile, reactive hospital system to a robust, proactive defense. It's built on early recognition right in the community, giving people the power to make decentralized decisions about their health at home, and taking antimicrobial stewardship incredibly seriously so we stop abusing these drugs. But above all, it's about reclaiming that lost art of history-taking, treating people as complex, whole human beings again, rather than just another checkbox on a screen. Because, guys, we really cannot forget the stakes here. 10 million. That is the number of people who could die every single year by 2050 if we just keep doing what we're doing, if we keep abusing antibiotics and ignoring this failing system. That is literally more than 5 times the official global death toll of the COVID-19 pandemic, but happening every single year. The old path is breaking down, the resistance is building fast, and the source material makes it crystal clear. If we don't start embracing decentralized, preventative models like Dr. Maya, we are sleepwalking into a massive catastrophe. Which leaves us with one final, absolutely critical question. Are you ready to take control of your health in the post-antibiotic era? The sources argue that the tools and the knowledge to separate real illness from imaginary panic are available right now. It's time for all of us to really rethink how much we rely on these traditional, overwhelmed systems and start empowering ourselves. Thank you so much for joining me on this deep dive into the explainer. I really encourage you to reflect on your own choices when it comes to your health because your life might literally depend on it.